The medical director of the Upper West Regional Hospital, Dr. Robert Amesia, has disclosed that his outfit is seriously working to set up a center for the treatment of childhood cancers. Speaking after a two-day training workshop on treatment of childhood cancers at the hospital, he noted that one major barrier to the delivery of quality healthcare in the country is distance to healthcare facilities. Rafiq Salam reports from WA.
One major health condition that health practitioners in the country has been grappling with is childhood cancer. Though there is no available statistics to this medical condition, it is not uncommon to see many children with the condition at various health facilities seeking for treatment. It is a global phenomenon, according to a pediatric oncology nurse at the Community Teaching Hospital, Baturi Conrad. He said many are unaware of the disease, coupled with the myths and misconceptions that children cannot get cancer, hence the need to organize a training workshop for staff of the Upper West Regional Hospital. Baturo Conrad opined that cases of the disease is now widespread and there is therefore the need to take prudent measures to tackle it before the situation gets out of hand.
All over the world, there are myths and misconceptions about cancers, where people think that children cannot get cancers, and when a child gets cancer, that child is a witch or is a bad omen for the family. So, but I just want to throw, more light on these things so that people can come to the understanding that childhood cancers are real. It's becoming common nowadays. So it's only prudent that we take measures now, because whether we like it or not, childhood cancers have come to stay with us and it's part of us. So we need to take measures, to mitigate or to identify these cancers early so that early treatment can commence, because early identification and treatment of these cancers leads to good prognosis. However, when they come in an advanced stage, advanced stage here means that the cancer have already spread to other parts of the body. At that point, the treatment becomes very difficult.
The participants were taken through several topics on cancers. Their focus, however, was on the early warning signals, which you will want the participants to take seriously.
One of them is having a white spot in the eye, what we call leukocoria, or cat-like eye or torch-like eye. When you see a child with a torch with the eye looking like a torch, or that of a cat, normally in the middle of the eye, in the retina, it's telling you that this child could have cancer. A child complains of bone pain, always complain of bone pain, you should be thinking cancer. So we have something we call CCC, which is considered childhood cancer. So when you see some of these signs and symptoms, you have to consider childhood cancer. Some of them, the cancer that affects the brain, the child has early morning vomiting, because there's pressure on the brain. The child who has easy bruising, some of them when they brush their teeth, with just a little pressure on the gums, they begin to bleed.
Medical director of the Upper West Regional Hospital, Dr. Robert Amesia, disclosed that the training embarked on forms part of preparation to set up a cancer treatment center at the hospital.
One of the barriers to treatment is distance. So usually, sometimes you refer people to go to Kumasi. Some don't have relatives there. Even if they have relatives there, they need to go accompanied by other people. So it gets difficult. They go for one cycle of treatment, then go for another cycle of treatment, then they stop. And usually, if you don't complete the treatment, you don't get the full benefit. But if we have a center very close to our people here, the likelihood that compliance to treatment will be very high is what we are looking at. So we think that we should start a center here and bring the services very close to our people.
The training program is being funded by a UK-based organization, World Child Cancer, which has been in existence since 2007. Seth Kanekure is its monitoring and evaluation specialist.
We have been getting a lot of referral cases per our data from the Upper West. And then last year we signed a pact or MOU with Ghana Health Service. And since our regional hospital is also under Ghana Health Service, we came here to also build the capacity of the staff for the early detection. And when a child is also diagnosed with childhood cancer, what the staff should also know and provide the needed care. For child cancer, when we started, I can say that we have been able to support over 1,000 healthcare providers, or let me say healthcare workers, as far as training is concerned across the whole country. And then also World Child Cancer also provide both financial support and emotional support to parents.
Reporting for Joy News, Rafik Salam. Wow.